MBS was proposed as an outcome measure by the FDA in acute studies. So in the RELIEF study, it was used differently than it was in PROMISE 2, and I want to differentiate that. In order not to have to reach statistical significance for all of those, the FDA said, well, let's just take the one that is most bothersome to the patient. So as a way to streamline and instead of having 4 or 5 primary endpoints to a study, you could get this down to 2 co-primary endpoints, which was headache freedom, pain freedom, and freedom of MBS. So that's how it is used in the acute studies. What we did in PROMISE 2 was something very unique. We recognized that in chronic migraine, that's migraine that is occurring more than 15 days a month, that there's very little time for the nervous system to recover between migraine, and there's lots of symptoms that sort of linger even from one attack to the next. There's a broader group of symptoms that might be occurring. And so what we did in PROMISE 2 is allow people to choose whatever symptom they had, whenever they had it, as being their most bothersome symptom. So this is one of the first time where patients were allowed to sort of be in charge rather than the study design or the more traditional medical symptomatology. And in that study, we found that a large number of symptoms were included. And about 40% of these were even beyond what we traditionally look at, which is the nausea, the photophobia, and the phonophobia. And the interesting part here is if people experienced relief of that symptom, it had a very, very high correlation with their global impression of change in the study. So if they found benefit of their most bothersome symptom, their satisfaction in terms of the global impression of change was highly correlated. And I think that's a unique study, and we're trying to explore that. It's a very simple endpoint, but it's very personal. People can choose, if it's a change in their mood, for example, or they're just fatigued and tired, or it's their cognition, it's the brain fog that might be with migraine. We can look specifically at what is bothering them.